Welcome to another MedTech Gurus podcast, where we meet and discuss trending and educational topics that are important to today's medical technology sales and marketing professionals. Now, it doesn't matter if you're new to the space or if you're a seasoned medical sales and marketing professional. You all have come to the right place. You see, the medical technology world is ever-changing, and MedTech Gurus will help you stay up to date by interviewing experts and opinion leaders. Now, we call them gurus, and they will bring you information, techniques, and strategies that are sure to help you enhance your knowledge and help you bring value to your customers and your company. Now, I'm Sylvester Harris, and I'm pleased to introduce your host for MedTech Gurus, Mr. Tom Hick.
Hey, what's going on out there, Gurus? This is Tom Hick, your host of MedTech Gurus, and welcome to episode number 286. Imagine a world where artificial intelligence and remote monitoring work together to detect and prevent life-threatening cardiac conditions before they escalate. That's exactly what today's guest, Stuart Long, CEO of InfoBionic.AI, is pioneering. With over 20 years in medical device industry and leadership experience at companies like Monarch Medical Systems and CapsuleTech, Stuart is no stranger to driving transformative change in healthcare. At InfoBionic.AI, he's leading the charge in AI-powered remote cardiac monitoring, revolutionizing how arrhythmias, especially atrial fibrillation, are detected, treated, and prevented. In this episode, we'll dive into how real-time continuous monitoring is reshaping cardiac care, improving patient outcomes, and reducing hospital readmissions. Stay tuned. This is an episode you won't want to miss. But before we get into the episode, let's thank our sponsor, Accelerant Consulting. Gurus, GPOs, RPCs, IDNs, it can make your head spin. Don't go it alone. We understand you need to get those sales going and boost that bottom line, and you need to do it now. Let the experts at Accelerant Consulting guide you through today's complex healthcare market. Check them out at accelerantconsulting.com. That's EXCELERANT consulting.com, and do it today. Okay, Gurus, here it comes, episode number 286. And remember, if you like what you hear, please subscribe, leave a review, and most importantly, tell a friend. Welcome, MedTech Gurus. Today, as I mentioned in the introduction, we have a fantastic guest with us. Stuart Long, CEO of InfoBionic.AI, joins us to share his insights on how artificial intelligence and remote cardiac monitoring are transforming the detection, treatment, and prevention of arrhythmias, including atrial fibrillation. Stuart has over 20 years of experience in the medical device industry and has led growth initiatives at companies such as Monarch Medical Systems and CapsuleTech, which was acquired by Qualcomm. At InfoBionic.AI, Stuart is spearheading efforts to revolutionize cardiac care through AI-powered solutions that provide real-time continuous monitoring, helping healthcare providers improve patient outcomes and reduce hospital readmissions. Hey, Stuart, are you ready to be our guru today?
I sure am. Thanks for having me. Good to be here. Thanks.
We're excited to have you, and thanks for joining us. So one of the things we'd like to start out with is just kind of tell us something fun about yourself or your family so we can get to know you a little better.
Sure. Yeah. I have been at this medical device element for quite some time. So I like to say I love what I do. My work kind of intertwines with my personal life, but I would say that I come from a family of healthcare, and I think probably the interesting thing is what drives me that I used to go on visits in the home with my mom. She was a home healthcare nurse, and so I got to see at a very, very young age the frailty of the human existence in terms of aging and things of that nature. And my mom was great with the bedside, and I learned a really good lesson from her about how to care for, or feel for and have empathy for those that need care. And I think that's driven me towards my career. Outside of work, I pretty active. My family, we love to travel. We got our kids on the road on their first transatlantic flights by the age of 6 months. So they've been probably in more countries than I had been in the first 30 years of my life, and they're still single digits, right? So So we spend a lot of time with the family. We do a lot of traveling, and it's maybe
That's-
uninteresting to most, but we figured that rather than things, the experiences are more valuable.
Yeah, it seems like the younger generation that is coming up loves experiences much more than any kind of a gift you could give them, right?
It's so true. They really do. And it's just fun to see the world through their eyes and how they can, how they assemble what they think is home and how that changes when they go international and see just all the different cultures. So.
Yeah, that's phenomenal. So, Stuart, atrial fibrillation, or sometimes it's called AFib, is a growing concern, right? It's affecting something like 10 million Americans, if I've got that right. Can you explain to us why early detection of AFib is critical and how InfoBionic's MOMI ARC platform addresses this need? Can you give us some insights there?
Yeah, sure, definitely. So AFib is probably one of the most common arrhythmias that people don't know they have. So they're asymptomatic. So you don't feel it, you don't have it. And one of the challenges is with atrial fibrillation is your atrium, which is the top side of your heart, they fibrillate, they kind of vibrate almost, if you will. And what that does is it slows down the blood flow moving through those chambers. And anytime you slow down the blood in your body, it'll tend to coagulate. And it's your body trying to heal itself, and most generally in a low pressure system. So when it coagulates, then it can create a clot or some sort of embolus, if you will, and if it's on the left side of your heart, it's a free tollway directly to your brain. And so the most common downstream effect is a stroke, and that's just a piece of that coagulation that gets up to your brain. And certainly, once it gets to a stroke level, then it's much more difficult to treat. The cost goes way up. So early detection is key. Now, the trick is a lot of people don't know they have it. And so if they have surrounding symptoms, and sometimes they don't have any symptoms at all, but they may have some sort of history of stroke in the family. So potentially even getting screened or at least letting their physicians know, clinicians, general practitioners know that there's a family history is key, because when somebody may be feeling a little bit dizzy or shortness of breath or have some, or even pass out for that matter, then the first thing they'll do is test with a monitor to find out if in fact you have the signs and symptoms of atrial fibrillation. So the sooner you can treat it, the sooner it gets dealt with. You can prevent the onset of strokes, whether that's medication or somebody going to do a procedure. I'm a living, breathing example. I just came from a cardiac ablation let's see, 2.5 weeks ago.
Oh, wow.
So I found mine. Mine was induced. My AFib was induced from endurance exercise. Little known secret that is very widely studied. So I can say I was fortunate that being in the business and pretty sensitive to what was going on, we identified it early. And it was 5 years before I actually had an intervention. We treated it with medication. We waited for it to progress. And during that time, the technology made leapfrog advances and made the procedures much more safe. So I can say that I'm a kind of a card-carrying member of the AFib market, and I was an early detection, and it saved both me a lot of trouble to find it early. It saved the healthcare system, saved the insurance payers and my family and everybody a lot of time and tension and money.
Yeah, that's interesting. First of all, I'm glad you got through that and you're healthy and things are progressing nicely. So that's fantastic. But with the aging population, we're all getting older. And it seems like there's a lot more hypertension and diabetes and obesity out there. So with that, I with some of the research, it looks like AFib cases are on the rise.
They are.
So maybe you could explain to us how InfoBionic's technology helps clinicians identify and then manage those high-risk cardiovascular patients.
Sure.
Can you take us a little deeper there?
Yeah, I alluded to it in the former comment about other signs and symptoms, right? So there's kind of converging lines of what we call comorbidities, right? So other disease states that when left unchecked you can pay a heavy price for that in terms of your health, and including death, right? So unfortunately, diabetes, hypertension, anything to do with the function of the blood flow and electrical activity in your body directly can involve your heart, right? So we deal with monitoring the electrical side of your heart. So it's kind of like your house. You have electricity and plumbing. We look at the electricity, and the plumbing is the actual squeezing of your heart, the blood moving through, just like plumbing in your house. So if there's hypertension, so there's high blood pressure, and so you're putting extra pressure on the heart, so the heart's working not as it should. You compound that with diabetes, you compound that with obesity, poor diet, family history. All of those can converge and create kind of a really ugly soup, which is the perfect environment for atrial fibrillation, right? And so that is a big driver. Those are big drivers, right? So it's interesting. We can eat lots of candy and not good food and go to the dentist and they'll tell you have a cavity, right? You can get plaque on your teeth and brush your teeth. But there is no brushing the inside of your heart. You can't do that daily, right? So a lot of times the symptoms don't show up until possibly too late, unless you're really good at reading the tea leaves. And a lot of people aren't. They just think, oh, I just don't feel good today, or this was that. And it kind of gets written off till it becomes, I need to go call the doctor. And that's generally when the intervention has to occur sooner, meaning it's not just treated with medication. We may need to do something that's invasive, goes inside the body and things of that nature. And that's those cases are on the rise. All the interventional studies of devices being implanted in the body, all of the tests that we do to find this stuff, our business in the market is growing to try to measure and monitor these tests, especially in the aging population. And even more so in the younger populations, just due to the obesity rates that we see and the associated hypertension and diabetes that goes with that here just in the U.S. alone. So it's a challenge, but our product works from the perspective of once the physician thinks there's an indication, then he'll prescribe our device, and our device will be put onto the body. Generally, a couple ways to get it. You get it at your doctor's office, or you've been somewhere and they don't have it in the office. They use a third party that uses our device, and they'll send you home. And then a service center will contact the patient and send us our device. But the device itself is worn discreetly. It's a wireless sensor that you put on, wear it under your shirt. You can carry an extra cell phone that we give you that ensures the connectivity all the time, that continuous monitoring. And that's where we try to really differentiate ourselves in the market, is sending that information, in continuous strips, we'll call it, almost real time. There's some, slowness on the network connectivity if somebody's in their house and they don't have a good cell phone connection in their basement, that kind of thing. Those kinds of things occur. But for the most part, I'll quote the chairman of cardiovascular medicine at Mayo Clinic. He's made a quote that just says, the single most important thing we can do is see it or be there when it happens. So being able to catch something as it's occurring is really important. So this continuous nature and this very quick ability for us to get that information in front of a clinician, have an alert go that's specifically for a particular kind of arrhythmia in a very quick way, so they can alert that. And we've got thousands of stories now where we've been able to find things for patients actually in the emergency room wearing our device because it's continually monitoring. You're sitting in the hallway on a bed or not being monitored, and our device is notifying the doctor, while they're in the hospital, right? So they can intervene and do a procedure in many cases, or many cases, people have been doing something, sleeping even. We wake them up and say, there's something going on. You need to go to the hospital right now. So, or the physician does, right? So it's monitoring the patients, sending the data up, to the cloud. We use some FDA approved AI or algorithms that we've had since inception, and continue to evolve those as we go forward in time. But that's what helps us become really efficient in getting that information out to the clinicians so they can identify it as quickly as possible.
Yeah, I like that. I like that near real-time aspect of it, because I'm old enough. I remember the old Holter monitors, right, where you'd have to record all this, and then somebody would have to read it and score it and all that, and would have a hard time searching out those events. So I think it's rather novel, right? So if something's occurring, that you can identify it. And I think those old monitors were frustrating for the patients too, because they knew they had something, but it was kind of lost in this pool of data, right? Are you finding
it still exists today? There's many monitors that don't communicate. In fact, there's one segment of the market where they specifically ordered the test not to communicate. In fact, that was one of the tests that the doctor ordered for me outside of with the vendor that they use for their facility, and I was able to put mine on and send it real time post my study before that device even arrived at my house, right? So I felt more comfortable just simply, and we caught some arrhythmias that occurred, not unexpected, but that the benefit of having something able to be put on at the site where I had the procedure or at my clinician's office, you get it right away versus waiting for it to be mailed to you at home.
Yeah, that's helpful. And then, we all know and we've kind of observed that remote patient monitoring does reduce hospital readmissions. So I'm curious if you can just kind of walk us through the platform and what you're seeing and how it helps healthcare providers achieve this and then improve those overall patient outcomes.
Yeah, absolutely. So typically, when people are discharged, they have to go through a standard of care to ensure they're safe to discharge and they've met all the criteria. And part of that criteria in today's world is really about reducing the readmission. So if you're discharged, cardiac related, maybe post procedure, something like that, a really good example is if you've had a valve replacement. And the way they do valve replacements now is minimally invasive, right? They can replace your it's called a TAVR, trans aortic valve resection, right? So it's a very you can do these in an outpatient setting even, and so normally you would want to keep that patient in the hospital and monitor them. So we're able to discharge them sooner. And we're able to, normally what would happen is if you weren't monitoring the patient in a kind of a continuous way, patient would feel the potential risk of an arrhythmia that gets introduced as a result of this procedure, not unexpected. But if the patient doesn't know about it or we don't have a monitor on that patient, they're going to go back to the hospital for sure because something's wrong. They feel it, they know it, they feel dizzy. And so in our case, what we can do is monitor that, have another person out the end of that wire, call the patient, reassure them, everything's fine. We expected this. We're not seeing anything unusual. You can stay home, or we do see something unusual. In that case, go to the hospital. So it's opening up a line of communication and visibility into what's actually happening with that patient, and we'll call it in the cardiovascular realm. And it's another great example was back in the pandemic and just keeping somebody. They were discharged from the hospital. She kept having trouble, and the doctors were able to use our device to help titrate or just measure the medication dosing. They had her change that, and so then they saw that on the monitor, it fixed it, and they said, "Okay, you don't have to go back to the hospital." And in other cases, they've said you do need to go back to the hospital, but don't go to the ED. We're going to send you right to the exam room. So there's a lot of ways, I think, both in terms of length of stay in the hospital as well as the readmission, where we can address that just by giving a line of sight to what's actually occurring at the time it's occurring.
Yeah, that's phenomenal. I'm also thinking individuals that are in rural areas or a long way away from that provider, right? That's going to provide an extra level of comfort for them to know that they can have somebody watching over them and know, okay, you need to go, or it's all good.
It does. It does. In fact, we collaborate with the Mayo Clinic. They utilize our product, and we have they're an investor in our company and sit on our board. So but a lot of their patient population is very rural. And so historically, they would have to drive 200, 300, 400, 500 miles, stay in a hotel overnight, get a Holter monitor for 2 days, wait to see if it was negative. So they've incurred hotel costs. And if it's negative, which is anywhere between 70, 80% of the time, they would get a longer term monitor put on and then they'd go home. Where in this case, you don't even have to travel anymore. We'll send that out to you. We can do the 2 day and then transition over to the longer term monitor if we need to. Everything can be done remotely via mail. Just fundamentally different. And to your point, and I can attest to this, it's kind of when you put that gown on in the hospital, all my experience in this field, it just goes out the door. I'm a cold, alone patient, right? And so I have nobody there, maybe other family member, but you're just, but having that monitor and knowing that there's an expert on the other end of that line is unequivocally peace of mind. It was for me, and I know it is for the thousands of patients that use it for our product today. We get lots of great notes about it. So it is very reassuring, without a doubt.
Yeah, that's awesome. And then, Stuart, artificial intelligence seems like it plays a major role in the solution at InfoBionic. What were some of the challenges you faced integrating AI into your platform, and how did you and your team overcome those?
Sure. Well, I'll kind of look at AI in a couple of phases in time, and then I'll kind of break it apart into workflow efficiency, and then another component of clinical, right? And clinical is actually making diagnosis, finding clinical findings, and workflow efficiency is just making it easier for clinicians and technicians. But if we go back to our inception, we were the first cloud-based solution in the market that actually used machine learning. And machine learning is just basically we take a bunch of data, we have experts go through it, and we mark it up so we know what's normal, what's abnormal, and then we get enough of that data and we train an algorithm using the machine learning technique to know what's the difference between right and wrong. And so we were the first company with that. And that, before AI became common in our vernacular, right? It was signal processing using machine learning, and we were able to institute what are fixed algorithms, because we don't want to be doing anything dynamic where we're making decisions on the fly about something. We're getting close to that, but long ago, 8-9 years ago, we weren't there yet. And the FDA was much more tolerant of, okay, you've got the clinical and the data to prove that it does this every single time, and it's safe and effective, so we'll approve that. And so we kind of, as we go forward in time, we've been able to tune that where we get better at looking at the noise. And so one of the thing about a remote environment is you're moving all the time, so the signal looks unreadable. So trying to minimize the noise. So we were able to implement some AI that helped us use 3 wires and give 3 little squiggly lines to actually go from 3 lines to 6 lines. And so we were able to go from a 3-lead to a 6-lead view and virtually create some additional leads, what we call the limb leads. And from that, it's really interesting. You can have a bunch of noise, and in one of those lines, it'll just be one clean signal. So it acts a little bit like a noise cancellation, like your headphones do. And we've seen a lot of physicians just really kind of enjoy this, because it'll look like almost even lethal arrhythmias in some cases, where in the next line it's just your normal heartbeat, what we call normal sinus rhythm. So that was kind of midway through the point. And where we are today is, the FDA has got AI agency, right? So they're experts in all of this. And again, it is very much mostly still fixed, where we're working with Mayo Clinic to bring their AI ECG research to market. We work with another company that's part of that. It helps helps us go through the FDA. They've already had some FDA clinical algorithms now where we're looking for latent disease. So even from a screening perspective, it's even better than waiting for the symptoms to occur. We can use data and an ECG to detect if you have something that might happen in the future. So the first algorithm that was approved to be able to detect the left ventricle ejection fraction. So how much is the left side of your heart pumping blood? That's the high number on your blood pressure. And is it pumping enough? And is it normal? And so we have a watermark, is above or below this line, and one is good and one below it is not good. So we can do this now through your ECG, and we don't need an ultrasound, which would normally be needed. So we're training that algorithm right now from the current FDA approved, which was an inpatient 12 lead, the gold standard stationary. We're doing that on our 6-lead device, and we've taken 20-minute random samples versus what you normally do is a 10-second static laying down position, very clean signal. And the early data has been extremely positive. So we're working now to submit that to the FDA, and we hope to be the first company in market now with some clinical AI that helps detect latent disease never before done. And we've got a pretty strong pipeline behind that deals with hypertension and cardiomyopathy and high potassium without having to do blood testings of that nature. So very interesting. So we've gone from an early phase where it was more signal processing, machine learning, to now we're at that point where we can get these dynamic algorithms to try to detect latent disease and make decisions on the fly.
Yeah, that's awesome, and thank you for that explanation. That's really helpful and interesting. One of the things I was intrigued with that, and help me out here if I don't have this exactly right, but it would seem to me that going from that 3-lead capability to that 6-lead capability, that some of that diagnostic quality was highly improved and probably led you to where you're headed today. Am I heading down the right track with that?
Yeah, in fact, it does. And in fact, that's where we're training the AI on, is the 6-lead signal. We could probably do it on a single channel or the 3-lead, but in fact, Mayo Clinic published a study. We did an internal study with them, and they published on this where they believe there's a tiered monitoring strategy. So there's the patients love a patch, right? But the patches are typically one line only, and that's great. It works great for AFib, by the way, and for a vast majority of the population. But when you get converging lines of comorbidities that I mentioned, and you start to get all these complex things happening, and you get into more complex arrhythmias, the single lead, the one line just isn't enough. There's not enough morphology inside of that line. So you need to compare it to other vectors in the heart in order to substantiate the findings. And that's where the additional leads help. And we can, we've made this leap, and now going to adding an additional wire to get all the way up to 12 leads it's a small step versus the first big leap. And so we'll continue to progress where we'll have remote 12 lead capability. And there's people already doing it today. So there's a good precedent for it.
Yeah, awesome. And when I was doing my research, I was also struck by, InfoBionic in your MoMe ARC platform. If I've got this right, it integrates seamlessly with existing healthcare systems, which I think is really novel. How important is that interoperability in the adoption of MedTech solutions? Not only yours, but others. And, what best practices can you share from that?
Yeah, I think the first integration you do is into the electronic medical record, right? Mm-hmm. And there's the kind of the entry level is we print out a PDF file, or then they can fax it. Believe it or not, people still do that. Or we can scan it into the electronic medical record, and you've got a static snapshot all the way up to where we can have a bidirectional feed where somebody can be in the electronic medical record looking at that, and then tap into our system and get the live feed or the playback of the ECG that might have had that event, so they can see the quality morphology from its origin, right? So those are some more advanced integrations. Further, you get into the ordering system, right? So doctors don't have to figure out how they need to do it. They just order it, and it's system wide, and they know that they need to do this test. And so that allows the healthcare provider or healthcare hospital system to have a high degree of control of what gets ordered when and how, so it gets billed correctly, things of that nature. So those integrations, when you get to that level, I think are the real reason why we would see wholesale change in rural care, health equity, the ability to provide services at any scale, whether that starts on the inpatient side, reduce the length of stay, transition those home. I think the percentage, I can't give you a precise number, but it's a high number when patients are discharged from the hospital. The hospital loses sight of the patient where they go. Yeah. And so being able to use the IT systems to discharge to a practice that the hospital may own or to a facility that they may not own, but we can use monitoring capabilities to maintain that tether, electronic tether, so we know where that patient goes and how they're doing. And so that level of integration, I think, is key for any of the vendors and any ology for that matter. And it's pretty sophisticated and mature, but we saw a rise in telehealth systems during the pandemic, and those systems generally don't or haven't been widely adopted and integrated into the enterprise EMR system. So I think we still have some ways to go, but what took us to go 20 years, we can probably do in 2 years now, just because of the maturity of the systems.
Yeah, that's phenomenal. So, Stuart, I want to just shift the conversation a little bit here, because many of our listeners, our gurus out there, are entrepreneurs or soon-to-be entrepreneurs. In your career, you've had a lot of leadership roles and driving innovation. And I'm just wondering, with some of your mentorship that you've done at places like Everwise, if you could share some of your key learnings from that experience and how it's influenced your leadership style. Can you share some of that with us?
Yeah. One thought, I think perseverance is critical, right? Because there are the unicorns of companies, right, that just take off and they go, and that's great. But I think the adage is rough seas makes a skillful sailor, and the value of a boat is not sitting in the harbor, it's out at sea. And you'll go out to sea and you'll be in harbor, right? It's not, and you're going to have good times and bad, and it's the being able to navigate the bad times, whether it's people, resources, technology, performance of the company, fundraising, staying true to it. I can say that we've survived many rough sea where there's we got awful close a couple times, where we started to wonder, right? But perseverance, having the right partners at the table, those that believe in what we're doing. I think that's key. I think in healthcare in today's environment, having a partner with a clinical entity is really important. Because when you're a company our size, we're small by comparison. If we want to try to go and negotiate with the payers in the industry who are juggernauts of different kinds of value-based contracting or risk-based contracts, it's easier for a larger clinical entity to go and do that for their own facilities and utilizing our technology. And so it's just a different way to approach. And it's a bit of a shortcut in line, right? So, but outside of that, I think the other piece is, what I've got from mentoring is just be open-minded, right? So I've mentored some folks that are infinitely smarter than me. I think I learned more from them than I did across the board. But I think having a mentor, somebody that you can go to. I had a CEO tell me once, he's like, yeah, CEOs, they don't tell you it's lonely at the top, right? Because you can't really go talk to your board or any of your peers, because then they'll think you're not capable or weak. And so having a mentor, that you can go and talk unabashedly with has been great. And I've always had one and continue to have one, and more than one, in fact. Some I call friends now, former executives that I've worked with. So I think that's having the open mind to know that you're never going to get it perfect. There's always something. You strike gold every once in a while. You get lightning in a bottle. Ride those waves for what you can, but never get overconfident. I think because there's always somebody out there waiting to take your number for sure.
Yeah. I love that mentorship part, right? It's always good to have that outlet in somebody that you can just bounce those ideas off in a harmless and safe environment, right? And then I also wanted to ask you, medtech startups these days face some significant hurdles in scaling and securing market adoption. I'm wondering what advice you might give some of our early stage companies out there that are trying to navigate those challenges. Do you have any insights for us with that?
I think the first thing that comes to mind is, I've tried to raise capital for a great algorithm, right? But there's a lot of great algorithms, and all the investors know that, right? So it's not just about your algorithm. Investors are looking for people first, and then if you've got a great solution that solves a really good problem, they can get behind that. Now, a lot of it is you need clinical data, and you need studies, and you need funding to fund that, and it may be 2 or 3 years before you can actually get to market. Mostly on the life sciences side, that happens a lot, but I've seen that now in the med device side as well. And so finding the right investment partners is critical, where, if you're early stage and you need runway, before you ever get to market pre-sales, then, being able to find the people that are in that sector that would believe in your cause is key. So I tell you, I think I went through at least 100 different investors before I found the right one that's helped us put us on the map where we are today and still with us. And there's not just one, there's a few that go behind that as well. But I think that's probably the biggest piece of advice I'd say is find the right partner. It's okay to be picky. Don't just take the first one that offers money, unless you're having a really difficult time raising money. Right? So, but then you might question what, kind of the reason for being at that stage. But if you've got a great team, and I think even less than experience, or even more than experience, is just the attitude of the people and the doer mentality, and teamwork building. Somebody who's a kind of a cross-functional leader tends to grab the attention of those in that field, whether it's angel investors or Series A, even into Series B. But I'd say that's probably one of the most critical steps if you're looking for funding to get if you're pre-revenue and you've got clinical study, it's going to take money to do it, and that's where the investors are really handy.
Yeah, I love that. And I would think that, and help me out here, but I would think that finding that right investor group or individual, depending on what your stage is, I'm sure, they all want a result, but along the path you mentioned, sometimes the seas get choppy. I would think some of their patience and some of their guidance at that point would be useful. Is that what you found?
It is. And it's one of the key things. I can say that we've got really deep healthcare investors, in our cap table, and they're great because I can give them a deal name, and they may know somebody, right? Very very helpful. But our largest majority investor is not from healthcare, but they're exceptional at operational excellence, and helped us navigate a lot of tough, difficult situations just from an operational perspective. So it's nice to have that mix, not just one slanted one in one direction. And we were fortunate enough to find the group that we've got, and they've been with us now for going on 6-7 years, right? And so it's they've had the patience, but again, they believe in people, and so it's not a secret. We had some legal battles that we had to fight with somebody suing us early on, and we won everything, and had it was all in our favor and frivolous what we were able to prove. So they took it as we had something that they wanted, and so they made that bet, and we ended up prevailing in the end. So that's kind of where they thought about the people, and we had a really good solution to it at the same time.
Yeah. Thank you for sharing that. That's really helpful. So, Stuart, this really sounds like an exciting time for you and your team at InfoBionic. What does the future hold, and where are you going from here?
Yeah, so we're super excited about the future. I think this construct of using AI to detect latent disease is fascinating, because being able to find disease sooner, as just like AFib, and it's not just AFib, there's a litany of these things that your electrical system has hidden in its signal, and it knows about it before it ever shows signs or symptoms. And so I think that's incredibly exciting, that we could actually bring that to life and have a real effect on patient care, which means the extension of life, right? So the other thing we're looking at is swimming further into this tiered monitoring strategy. Is there a way to utilize, take the place of these monolithic machines that you see in the hospitals? Can we supplant that with a small little device that snaps into a lead set that gives the same level of quality, but it can move with the patient, or we don't have to move the patient to a particular unit that's very expensive, that bed, just because I need telemetry. I could say, well, let's put them in a less expensive bed, or even better, I can send them home. Because the outcomes are patients always do better in the home. And so this tiered monitoring that I just mentioned, that's just that scenario, right? And so I think we put those two in combination. Tiered monitoring, take the monitor to the patient, regardless of their location, but provide inpatient level capability and maintain that tether, for the practices and the healthcare providers. We're able to demonstrate to the payers that we're improving outcomes, so we can lower the cost of healthcare and make it more efficient. And so that's our future, and that's what we're really focused on. And we're closer to that than you might imagine, and we feel excited about that. And so I think it has an opportunity to be a big impact.
Oh, that's fantastic. So, Stuart, first of all, I'd like to just thank you and acknowledge you for the time and preparation to be our guru today. If somebody wants to learn more about InfoBionic.AI or connect with you, what's the best way for them to reach you? Is there a website or in LinkedIn?
Sure.
How do we find out more?
Yeah, website is the best way. So our name is our website. So InfoBionic, InfoBionic.AI. And that'll take you right to our website. We have a fairly extensive resources page, and in the news, lots of great coverage, and you can keep up with us with our press releases. We're pretty astute about that. So anything you'd want to learn from there, and if you want to contact us, please fill out the website form and send it in touch.
Oh, that's fantastic. So once again, Stuart, thank you so much. We really appreciated your information and insights today.
I'm glad to be here. Thank you very much.
Thank you for listening to MedTech Gurus. I am Sylvester Harris, your MC. If you want to learn more about Tom and his consulting services, you can go to www.pctmedical.com or email Tom at tom@pctmedical.com. Now, I can be reached at Sylvester Harris, that's SYLVESTERHARRIS 5048 @gmail.com, and I'd be pleased to discuss any voiceover work that you may want for your company or broadcast. Hey, thanks so much for listening, and catch us on the next episode of MedTech Gurus.